Now this is the release forceps that you will see here. Now each forceps has two blades, right blade and left blade. You must identify which blade belongs to the right side and which blade belongs to the left side. Now the blade will consist of three parts. This is the blade itself, this is the shank, and this is the handle. Now you have what is known as the toe of the blade. Now the toe should always be pointing upwards and inwards. So how do you identify which blade belongs to which side? Now if I click this like this, the toe is pointing upwards and inwards. So this belongs to the maternal left side. Now supposing I keep the same other blade on this side, see what happens. The toe is pointing inwards and downwards. So this is not the maternal left side, this belongs to the maternal right side. So as soon as you start the procedure, you must first identify your forceps and see whether the instrumentation is correct or not. So now I am going to demonstrate an outlet forceps. As you know, the head is almost at the outlet. So the first thing that you have to do is take your blade in the left hand. You would have given episode may or may not be given. So you take your left blade in your right hand. The left hand is inserted into the posterior vaginal wall. Now this blade should be perpendicular to your hand. So you put this blade inside. The entire blade goes inside, and then once it's inside, you rotate the blade. If the head is rotated nicely, then your blade will stand automatically like this. Now the next blade is your right blade, maternal right blade. So for that's a direct application. Now you pass one hand between the pelvis and the fetal head, and this blade should be parallel to the inguinal ligament. You just slip this blade. This is a direct application. If rotation has happened and it's in a correct position, you would be able to automatically lock this. You just have to depress it a little bit and lock the blade. The only movement that you have to do is extension with the outlet forceps. This is how you bring about the baby. You don't have to pull the baby. The only thing that you do is just bring the forceps up. So that is what you do in a outlet forceps. Now extraction forceps that you might be having. Now you must know how to put these axis traction rods. Now there are two rods. You must identify which rod belongs to which side. You already know how to identify the left blade. This is the left blade that I have. This is one rod. Let me take this rod, and then I am putting this rod into this thing. This is how it is. So this rod should be parallel to the shank, and it should be pointing downwards and backwards. Now let me show you all. If I take the other side rod, see, this is how it happens. It is parallel, but it is pointing upwards. So this is not the correct rod. So once you've identified the rods, this is the right, this left, and then this belongs to the right side. This is your axis traction rod. This is how you assemble your Mealy-Morris forceps. How to do an LMC forceps. Now the application will be the same side. The prerequisites are the same. You put your hand inside posterior vaginal wall, and you're holding this left blade perpendicular to this hand. Now insert this blade fully inside, and then it should fully go, and then it should stand like this. The opposite blade is a direct application, like I told you all. So now you insert it, and then you put this lock. Now you must next know how to lock this axis traction rod. There's a small slit there. Now to fit it into the slit. Then you have this handle. So you put this handle inside. Now now everything is assembled. So what you do during the contraction, you only have to hold this handle and pull down, and then pull up like this.